right, so we are doing Blacks in Medicine, and um, my name is Kimberly Cooper, and then Julia Owens, Nissy, and Madison Braswell. Okay, so today's agenda we have key terms for Blacks in Medicine, and then we're going to talk about the history of Blacks in Medicine, and then our last topic is Blacks in Medicine today.
Okay, the first key term that we have is medical superbodies, which is the idea of enslaved women being medical superbodies, which is the theory. Well, the theory medical superbodies represents the experience of an enslaved woman as not only a medical subject, but also a representative body. During this time, Black enslaved women were seen differently than white women in the medical field, having been one of the most vulnerable groups. They were seen as being stronger and being able to endure more pain, which wasn't necessarily true. And the theory also represents the Black women being treated as objects for the benefits of white medical doctors to examine and operate, treat, and record their findings in medical journals that didn't always represent the enslaved accurately.
All right, so our second key term, I'm going to be talking about pathology and blood transfusion. So, pathology is the study and diagnosis of disease, and this branch of medicine examines the anatomical makeup, appearance of the cells, and genetic studies. Cellular patterns are observed under a microscope to determine if a sample is cancerous or benign. There are also processes to determine the cause and mechanisms of disease. And then I put some areas of pathology. There's surgical, which they can do like autopsies, and then cytopathology, which is cellular based, and then molecular and digital. And then blood transfusion defined is donated blood that is provided through a narrow tube placed in a vein in your arm, and it replaces blood loss due to surgery, injury, disease, and or bleeding. And the blood contains four main components. There are red cells, which carry oxygen and remove waste products, and white cells, which help your body fight infections, plasma, which is like the liquid part, and platelets, which help your blood clot properly.
Our third key terms involve microbiology and vaccines. Microbiology is a study of the biology of microscopic organisms that include viruses, bacteria, algae, and fungi. Microbiologists often go on to study their interactions with people and the environment around them, as well as how it affects the life around them. mRNA vaccines are the vaccines that give your cells a sort of set of instructions on how to find a certain type of protein that's found on the surface of the COVID-19 virus, which allows them to produce antibodies.
So this is one of our group member slides. I'll just read it. The history of the first Black doctor. So his name was James McCune Smith, and he received a doctorate in medicine. He was an American physician and an abolitionist and an author. He was the first African American to hold a medical degree and graduated at the top of his class.
Okay, next we have the history of the abuse, like the abuse the Blacks face within medicine. In the 1840s, James Moran Sims, a white doctor in Montgomery, Alabama, performed painful experiments without anesthesia on Lucy, an enslaved Black woman, while other doctors observed. Sims' experiments on Lucy were unsuccessful and nearly killed her with severe blood poisoning, and he continued to perform procedures on enslaved women, sometimes drugging them so they could not resist. Sims was called the father of gynecology after his experience on at least seven enslaved Black women and girls in Montgomery between 1845 and 1849. When the Constitution banned the international African slave trade, there became an issue with how the US was going to maintain and grow this system of slavery. So the solution was to make sure that enslaved women had children who lived past the age of 1, because slavery was a condition that was passed to the children from the mother. Um, Modern day gynecology advanced very quickly in the South. The doctors, including some that were also slave owners, had access to Black bodies, mainly Black women, and they would experiment on, examine, and cure or fix diseases and disorders. They would often use the term, like the term I mentioned before, medical super bodies, because Black women stood at this crossroad of being a universal norm of healing. Like Black women were more hypersexual, and Black women did not experience pain, and they were immodest. Um, Into this belief that somehow Black women were intellectually inferior to white women, but also physically stronger without any linkages being made to the fact that most Black women were slaves.
Okay, so the history of obstacles Blacks faced within medicine. So they have a racist history and has deep roots that have continuously affected African American health and healthcare. All theoretical scientific efforts at racial and ethnic studies since the Renaissance placed dark-complexioned people in the bottom ranks of the human family. History of scientific racism has profound healthcare effects on enslaved Africans and later African Americans. By the 1920s, all of America's medical and health profession schools were segregated according to race, gender, and class. This caused an unequal access to the nation's health system and threatened Black representation within the medical profession. Improvements were made following the hospital desegregation rulings in the federal court, and significant changes were made dramatically for Black health in 1965 for about a decade. But this ultimately came to a stop, and Black health started to deteriorate since 1980. Okay, so Blacks in medicines today. So I did research on Dr. Charles Drew, which is he's also known as the father of blood banking, and his background in education. So he actually attended undergrad at Amherst College, and it was on like a partial athletic scholarship where he was focusing on track and football. But once he graduated from undergrad, he worked at Morgan State University for about 2 years in order to save up for medical school. And then he got accepted into Harvard, but he was placed on a waiting list. And because like he didn't want to wait for his medical career to start, he packed his bags and moved to Montreal, Canada to attend McGill University. And while he was there, he and his professor at the time, Dr. John Beatty, began research in transfusion medicine following Karl Landsteiner's discovery of fatal reactions when incompatible blood is transfused between humans, ultimately resulting in death. So that sparked a research between him and his professor. And then while he was there, he also completed an internship in pathology and his residency in internal medicine at Montreal's Royal Victoria Hospital and Montreal General Hospital. And then unfortunately, his father died about a year later, where he had to accept a position near his family. And that was at Howard University's medical school. And a little bit about like the blood banking. So he became in 1938, he was accepted as a Rockefeller Fellow at Columbia University's Presbyterian Hospital in New York to study the storage and distribution of blood. So over the course of a year, Drew managed to increase the shelf life of plasma, which I discussed earlier is like the liquid part of blood, from 1 week to 2 months. So basically when it's stored it would expire or just go bad within 1 week. But during his research and his time at the Columbia University, it extended to 2 months. So it was very significant. And in 1940, Drew became the medical director of the Blood for Britain campaign to ship plasma to Britain for war victims. Ultimately, the Red Cross enlisted him to start a pilot program, which consisted of community donations in storefronts, factories, and blood mobiles. He then became the director of the organization's New York Blood Bank, where he was tasked with collecting blood with over 100,000 donors for the American military. Um, Unfortunately, he resigned from this position because of racial policy. So the military and the Red Cross adopted this policy where white patients could not receive um, blood from Black donors. So he felt that that was not right, and he resigned and he returned to Howard University as chief surgeon at Freedman's Hospital. And then ultimately he became the first African American examiner for the American Board of Surgery at 39 years old.
I researched Dr. Kuzmika S. Corbett. She spearheaded the development of the mRNA-based COVID-19 vaccine. She was born in North Carolina and attended UMBC here in Maryland in 2008, and she double majored in sociology and biological sciences, and she continued her education to obtain her PhD in microbiology from UNC Chapel Hill. She spent 7 years at NIH's National Institute of Allergy and Infectious Diseases under Dr. Anthony Fauci. Then she went on to lead a team at NIH to create the first vaccine to enter clinical trials and be approved for widespread emergency use within Moderna, Pfizer, and Johnson & Johnson, which was the big three of COVID vaccines, as we know. And she is currently the assistant professor of immunology and infectious diseases at Harvard School of Public Health. Blacks in medicine today, we researched some large-scale demographics and statistics. We found out that as of 2021, there are about 48,248 active Black physicians in the US. But as of 2023, we found that only 5.7% of all US doctors identify as either African American or Black, which is an increase of 4%, which in the past 120 years. We also found that of that 5.7%, only 2.8% of those are Black women. The largest Black medical school in the US is Howard University. They recorded a total of 2,451 graduates between 1980 and 2012. We also find that nationwide, Black women only hold a staggering 0.8% of all.
Any questions?